Here is a reality check. Western medicine is phenomenal at one thing: emergencies. Car crash, gunshot wound, heart attack, organ failure. Nobody does it better. But for everything else, for actually getting people healthy, the system falls apart because it was never built for that. People think hospitals are temples of healing. They're not. They're corporations. Most of them are run by MBAs, not doctors. And the business model isn't prevention. It's procedures, billing codes, diagnostics, and lifetime customers. And doctors? They're not villains, they're not evil, but let's be honest. They're trained inside a system that teaches them management, not healing. Prescriptions, not root causes. Symptoms. They're basically glorified sales reps for big pharma, and hospitals are their front-facing sales departments. And look who funds the research. Look at who sponsors medical schools. Look at who pays for advertising on every single major news outlet. If you guess pharmaceutical companies, you're starting to wake up. When the same industry that is selling the solutions also funds the data, writes the curriculum, and sponsors the media messaging, you don't need a conspiracy. You just need to follow the incentives. And when the incentives reward chronic illness more than lifelong health, you get exactly what we have today. A population sicker than ever. A healthcare system that is one of the leading causes of preventable harm. And an entire country trained to outsource its health to a pill bottle. And this is the part that people don't want to face. If you wait for the system to save you, you're already screwed. Real health does not come from a hospital stay. It comes from discipline, from movement, from nutrition, from sunlight, from sleep, from stress management, from taking radical responsibility for your own body. And there's no doctor who can do those reps for you. We are living in a time when the institutions that we trusted have become profit engines, and the only way out is personal sovereignty. This is one of the dominoes that has to fall for us to reclaim our health, our freedom, and our future. The revolution does not start in Washington. It doesn't start in a lab. It starts in your kitchen, your habits, your choices. And in the moment you decide you will no longer be a customer, but a caretaker of your own health. The system isn't broken. It's doing exactly what it was designed to do. And the moment you understand that is the moment you begin to take your power back.
The leading cause of death in the United States is medical intervention. Medical intervention kills about 1 million people a year. Doctors kill over 1 million people a year, and people go to their doctor and think nothing of it. The problem with our medical doctors is that these very good people make the biggest mistake of their life, and they go to medical school. Essentially, 85% of what they're taught is unscientific nonsense. And then they're cut loose on the general population to practice unscientific nonsense. The medicine we have is now so far behind the science that it is impossible to bring it up to date. And it's said that we have to take the medicine we have and discard it and start over. Where did we ever get the idea that we can help a sick person if we give them poison? It's a pretty stupid system, but it makes enormous amounts of money, and the drug companies have enormous power because they have so much money.
You don't get sick because you're getting older. You don't get sick because you have a bad gene. You get sick because your body has lost the nutrients it needs to stay healthy, period. Linus Pauling said, you can trace the genesis of every disease to mineral deficiencies, period. You run out of calcium and magnesium, you get high blood pressure, you get low back pain, you get an arthritic problem. You run out of copper, you get hemorrhoids, varicose veins, or aortic aneurysm. You run out of vanadium and chromium, you get blood sugar abnormalities, type 1 diabetes, type 2 diabetes, syndrome X, insulin resistance syndrome, whatever you want to call it. You run out of multiple nutrients, you develop uncontrolled food cravings and become obese. This is not your grandfather's Geritol. This is science-based, clinically verified medical nutrition, and interestingly enough, we offer it up for the masses. You need to educate yourself, ladies and gentlemen, about what you can do right now to support your body's built-in God-given ability to fix itself, because your medical doctor does not believe in that supposition.
John D. Rockefeller created the curriculum for the entire medical education in the world. And he made sure that only the chemicals he produced are used for the treatment of illness. no matter what it is. We are still working under the same premise today. That's why no medical doctor ever learns about curing anything. They learn about chemical intervention or surgery. Statistically, the suicide rate of doctors, MDs, the highest. Why is the alcohol and drug abuse rate statistically the highest with medical doctors? Very simple. These poor guys figure out over time that they have no tools and that they are murdering and murdered their patients. Because every doctor is a good person when they start out. The first year and the first 2 years, you're really excited and you're really in it and you're giving it all until you find out no matter what you do, the patient gets worse or they cure themselves. You just need to bridge them for a while. And then these poor doctors figure out they cannot help. And all of a sudden they figure out that all these people are dying. No matter what
I have ultimately closed my clinic. I have let go of my prescription capacity as a doctor. I can no longer prescribe drugs because I am convinced the only thing I can really do with a drug now is harm. There is no way that a human, myself or otherwise, is going to find a new chemical that is going to change the potential or capacity of that temple to do itself better. I just wholly now understand that to be absolutely an impossible premise because the design was so perfect at its origin. And any disease is a decrement away from that original design, not a failure of the design that now needs to be improved. We are that original design of this most complex expression of light interacting with water, interacting with protein, or the expression of building blocks of life itself. And for that, we built these temples that we call bodies,